It's happening. Adults across the country can buy cannabis. People have a lot of questions, so I invited some friends over to talk about it. Joining me today is Bob Yaciuk, leader of the Trillium Party.
We're growing up with the idea marijuana is going to fry your head and you're going to die before you're 15.
Tracy Curley, patient advocate.
I would like to think, Bob, that I could teach an old dog new tricks.
And Derek Ogden, ex-RCMP drug enforcement.
I think you'll see legalization really chip away at that the stigma for cannabis use.
I'm Chuck Rifici, and we're talking the biz. Canada is the first country in North America and the second in the world to legalize cannabis. Is this going to be good for Canada?
Absolutely. There's no way that it can't be. I mean, at this point, we're a country that's forward thinking. We're going to stop putting our citizens in jail. We're going to legalize a drug that is less harmful than alcohol and tobacco and finally have some common sense in this country. I think it's a fabulous plan.
Well, I think it has. We have to wait and see whether it's going to be a good thing or bad thing. It's like everything. So far, we're putting our best foot forward, but everybody's holding their breath to see how it's working. Right now, it's being unveiled through an LCBO type distribution. You don't think that's going to get a little bit of flack? Of course it is.
Well, that's just in this province, though. There's different models kind of happening across the country.
Well, fair enough. I guess I'm speaking because I'm the leader of the Trillium Party of Ontario, that I have a very Ontario perspective of it. We're so controlled, and we don't know whether it's going to be good or not. The prices are going to be through the roof. The quality is going to be poor. And I suspect, and that's just a gut feeling, that usage is going to go up and you're going to see the crime is going to flourish because of the way it's being distributed.
Yeah, I don't think I agree with that. You might see a little bit of a bump up with people using a little bit more in the beginning, and I think that'll just be that experimental side will come out. But I can't say that you're going to see crime is going to flourish because cannabis is really widespread use now. I mean, it's a multi-billion underground business as it stands. So I think that it's a good thing. I think they'll move toward a regulated market where people at least will have some confidence in the product that they're purchasing.
I would agree with Bob that policy coming out is not going to be perfect. I mean, they have to start somewhere. Certainly, I'm no fan of Ontario's model on the retail side.
I don't think anyone in this room is.
No, I mean, it's going to, I think, make it, I think, to be more black market where there are government monopolies than others, maybe a slower transition. But I think it's certainly exciting to start forward.
Well, don't fall for the bait, because right now you'll admit there's going to be a shortage of marijuana. I think that's pretty grand,
there
right?
There will be out of the gate for sure.
There's going to be a shortage in the LCBO type places.
A shortage of legal marijuana.
That's what I'm trying to get at. Well, I looked up the definition of cartel, and it went something along the lines of somebody that wants to control distribution, manufacture, sale, and enforcement of a product. Oh my gosh, the Ontario government's a cartel, and they're talking about drugs. Wait a minute, the Ontario government's a drug cartel.
Welcome to my world, Bob. Welcome to my world.
Bob, I mean, I think governments always control substances, control alcohol very extensively. When we look at Canada as a whole, I think, you talked about, will a new government regress or go back? Does anybody see a situation where we roll back? Like, I feel that the train has left the station on legalization.
And I think that you need to remember all the court challenges that have kind of brought us to this point as well on behalf of patients. The medical marijuana program has kind of pushed us to this point as well. I mean, we're talking about legalization, but there are a lot of legal marijuana companies now that started out strictly medical, waiting for this transition to happen. And I've managed a dispensary. I've openly sold marijuana when it was very illegal to do so, but Health Canada used to send patients to us. Now that role has completely changed. Medical marijuana dispensary has become a dirty word.
So why do you say it can't be turned back? You just showed how it was.
I don't think they're going to have a choice, but to allow for a more open market in Ontario as we progress.
I think the same thing.
They're not going to have a choice.
I mean, people will want the free market, right? And you look what they did with the licensed producers. They went to to the privatized model for licensed producers, and look at the job creation and the companies they built across the country. I mean, they went to multi-billion-dollar companies. They're employing hundreds and thousands of people across the country, and they built executive teams that were the cream of the crop. I mean, those are they're the innovators, and I think
but unfortunately, a lot of them that don't understand this plant, they don't understand the market, they don't understand the consumers.
You have to be mistaken because the government said they do.
But it's a fast evolving environment, and obviously, people are learning. We've never had this experiment of growing cultivation at this kind of scale federally. So generally, as we go into legalization, the average Canadian, somebody, let's say, that's not a fan of cannabis or that has young kids, how do you think they view this? I mean, is it good for them? We know people are concerned, and there's a lot of misinformation. I mean, how is this good? Or is it not?
I think it is because, again, drug dealers don't ask for ID. So if you have children, this is actually going to keep them safer. It's similar to tobacco. You used to drive by high schools and you'd see a bunch of teenagers out front of the high school all smoking cigarettes. Now it's 19 to buy cigarettes. You don't see those same crowds outside of the high schools anymore. I think, this is going to keep children safer. It'll be a little bit more controlled, and parents will know exactly where it came from, probably their own cabinet.
I take umbrage to that a little bit. I'd challenge that. I saw that challenging look. You're ready to take my head off.
Oh yeah, let's go, Bob.
First of all, the average Canadian doesn't approve of marijuana. That's the numbers, right? They don't. Now, fine, there's a lot of things that the average person doesn't approve of that we still endorse.
But just on that, I think the average Canadian wants to see it legalized, but I do agree that how it looks and how legalization unfolds, there's a lot of disagreement.
Yeah.
So, yeah.
Mm-hmm. Fair enough.
I would say the average Canadian doesn't think people should go to jail for cannabis.
I suspect you may be correct, but the average Canadian doesn't want their kids on using marijuana because we were grown, my generation in particular, and most of us here, were growing up with the idea marijuana is going to fry your head and you're going to die before you're 15. I mean,
that's called propaganda, though. And
whatever it is, but that's the average Canadian of my generation.
And I would like to think, Bob, that I could teach an old dog new tricks. And that maybe teach them a few things about the science about cannabis, about the fact that it is less harmful than alcohol, and in fact is less toxic than water.
I agree with that. Throughout my career, when I reflect back, and all the times I was involved in calls for violence and, these incidents that were these quick emergency incidents, I can't remember any that were involved with cannabis, none. It was almost always back to the alcohol side of things. So the one area I have, and I support legalization, the one area that I don't definitely follow is where they say they're going to keep cannabis out of the hands of youth. I'm really not sure. I think that's kind of a talking point. I don't think there's going to be a lot of impact on that side one way or the other.
And actually, from my perspective on the medical side, it's actually even more concerning because they're telling doctors not to prescribe to people under the age of 25. And there are children with seizure disorders that are now not going to get access.
But on this question, though, does legalization and the normalization that brings, does that help the medical patients? I mean, do you think medical patients are better off with legalization?
Actually,
this is an important subset.
I'm looking at it right now, and I can't say that it does. My patients are losing access. Prices are going up. They're being subjected not only to sales tax, but now sin tax.
So, ironically, we were talking earlier in this conversation how legalization, it's never going to go backwards.
Yet we've
given two examples today so far of it going backwards.
In the long run, it is better because licensed patients now, we're losing rights. There are people that in Newfoundland, in Saskatchewan, in the Northwest Territories, that have never been able to get access, medical or otherwise, that now will be able to. And that, to me, is definitely an improvement.
And I think you'll see
people that need it.
I think you'll see legalization really chip away at that the stigma for cannabis use, and that may motivate more physicians to consider that as a proper treatment. On the medical side, I think they really need to step up to the plate, put some set-asides in, make sure that the cannabis oil is there for the patients that need it, make sure that the flower is there for the patients.
It's ridiculous, the fact that, court cases time and time again have said that medical marijuana dispensaries are at the heart of patient access. And we're gonna have recreational dispensaries before a patient will be able to walk into a brick and mortar store and say, hey, can I talk to a doctor about medical marijuana?
I won't disagree with how I don't expect Ontario to change very quickly. And you look at cannabis policy across the country, a lot of the provinces are doing exactly what they did with alcohol. And so it wasn't a surprise, I think, what happened in Ontario. So we know there's going to be issues, there's going to be adjustments.
I wish they would have followed the beer and wine model that advocates have been kind of pushing for. I wish they would have actually looked at that more closely and gone, okay, so how do we, look at craft breweries, and how do we look at small wineries, and like, that's really what the end goal is.
Well, even the wine and alcohol models are still evolving, and so it's a moving target. Well, it's always great to go out on a high note. Thanks a lot for being here.
Thank you for having me.